Hello everyone, welcome to back my YouTube channel. Genotropin is a prescription medicine that contains somatropin, a synthetic form of human growth hormone. It is used to support normal growth and development in children with growth hormone deficiency, Turner syndrome, Prader-Willi syndrome, and children born small for gestational age who fail to catch up in growth. In adults, it is prescribed for growth hormone deficiency that may result from pituitary disease, surgery, or trauma. The purpose of genotropin is to help regulate body composition, muscle mass, bone density, and overall metabolic balance by replacing the hormone that the body does not produce in adequate amounts. Before preparing the injection, it is important to wash your hands and ensure all supplies are clean. Genotropin typically comes in a 2-chamber cartridge that mixes automatically when loaded into the genotropin pen. When the pen is activated, the diluent and powdered hormone combine to create a clear solution. Once mixed, check the cartridge carefully. If the liquid appears cloudy or contains particles, it should not be used. The medication must always be stored as instructed, usually kept refrigerated to maintain its stability and effectiveness. To administer the injection, rotate the injection site each time to avoid irritation. Common areas include the thigh, upper arm, or abdomen. Clean the skin with an alcohol swab and allow it to dry. Attach a new needle to the pen, adjust the dial to the prescribed dose, and gently pinch the skin. Insert the needle at a 90-degree angle unless otherwise instructed. Then press the injection button fully. Hold it in place for a few seconds to ensure the complete dose is delivered. Remove the needle carefully and dispose of it in a sharps container. During treatment, it is normal for healthcare providers to monitor growth progress, hormone levels, and overall health. Some individuals may experience mild side effects, such as redness at the injection site, headaches, swelling in hands or feet, or muscle pain. These are usually temporary, but any persistent or severe symptoms should be reported to a healthcare professional promptly. Genotropin should only be used exactly as prescribed, and doses should never be increased or repeated without medical guidance. Genotropin plays an important role in supporting growth and metabolic health when the body cannot produce enough growth hormone on its own. With consistent use, proper injection technique, and regular monitoring, many patients experience improved growth patterns, better muscle and bone strength, and overall enhanced well-being. The treatment process requires patience, but steady progress is often seen over time as the hormone gradually helps the body regain balance and function. Please like and subscribe to my YouTube channel